I could talk about all the research that's going on in the Women's Public Medicine Center and that I'm involved in 4 minutes. And fortunately, she told me I could select just one thing to talk about. But I do want folks to know what the spectrum of work that we do in the Women's Public Medicine Center, and that's really studying pelvic floor disorders from urinary incontinence, urinary microbiome stuff, pelvic organ prolapse. We have a currently enrolling NIH trial with the Pelvic Floor Disorders Network looking at the use of tibial nerve stimulation or an acupuncture treatment for fecal incontinence. So if you have patients with fecal incontinence, please refer them to our center. We're following up on some prolapse trials that will be very highly publicized, I suspect, and Dr. Nager will be presenting that at our national meeting next month. So really exciting stuff coming out of the Pelvic Floor Disorders Network. But what I want to talk about today is kind of my sort of area of passion, which is prevention. I started my fellowship really motivated to understand what causes these pelvic floor disorders after seeing how a lot of the procedures and things that we do don't have perfect results. So if we can prevent people from getting there in the first place, I feel like that's the way to go. And so fortunately about 5 years ago, the NIDDK aligned with this concept of prevention, and Tamara Bavendam became the project scientist. She was the scientist at Pfizer, actually involved in overactive bladder medications, and became passionate about this and moved to the NIH and has really revolutionized the way NIH is looking at preventive medicine. And the whole concept is transdisciplinary research. And so I've been introduced to a whole new area of scientific investigation, which has been really exciting. So this is just a roadmap of how this started and where we've been and where we're going. And so PLUS is called PLUS because it's the Prevention of Lower Urinary Tract Symptoms Research Consortium, funded by the NIDDK in 2015. And it was basically designed to bring a transdisciplinary group of scientists. And that, when we talk about transdisciplinary, I think a lot of people do multidisciplinary research. That's sort of what's going on in this room. But this is really getting bioinformatics and people who are experts in GIS mapping and public health researchers, people who are experts in diet and pediatrics, and you name it. So this is a really interesting group of people that have spent the last 2 to 3 years sort of aligning together to try and understand not a disease, but what's health. So the first phase has all been about defining bladder health, and it's a really hard thing to do. It's taken us about 2 to 3 years. We've just published the first publication on that. I don't know if, on defining bladder health, and we've come up with some conceptual models behind designing research questions of how to maintain health and how to prevent lower urinary tract symptoms. And one of the important things has been to not just look at health as the absence of disease, but using this transdisciplinary approach, we've really looked into understanding that it's the ability to really live a full life and has not just the absence of the condition. So that's taken a really long time, and hopefully this will be a model for other diseases like endometriosis, like irritable bowel syndrome, chronic diseases that we can really focus on the health component, define health, and identify what the protective factors are to keep people out of that disease state. Where we're going is once we've defined this, we're actually developing instruments to measure health, measure the spectrum of health, and identify people who may be at risk to design intervention programs for prevention. So that'll probably take the next 5 years, and then from there, once we've gotten identified the risk and protective factors, the goal is to design community-based intervention trials, things like clustered randomized design trials to go into community schools and educate young girls on healthy bladder habits and changed diets and things like that.